For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning, and thank you for joining us. My name is Susan Phillip. I'm the health officer for the City and County of San Francisco. And we're here this morning as Bay Area health officers representing the counties of San Francisco, Alameda, Contra Costa, Marin, San Benito, San Mateo, Santa Clara, Santa Cruz, Sonoma, and the city of Berkeley. You will see that we are not wearing our masks and we are not distancing. This is in accordance with both California and the San Francisco Department of Health orders, as we are all vaccinated and we are outdoors. We are here united in our support of opening California schools for full-time in-person instruction for all grades when the school year begins this fall. The lack of in-person learning has disrupted education, weakened the social supports provided by school communities, negatively impacted mental health, and prevented participation in the rituals and shared milestones that tie our communities together. This morning, you will hear from health officers from throughout the Bay Area about the urgent need to return to in-person school, and about the data, science, and facts that have united us in our guidance that students can safely return to school. Our next speaker is Dr. Scott Morrow, the San Mateo health officer.
Thank you, Dr. Phillips. I'm Dr. Scott Morrow. I'm the San Mateo County Health Officer, and if you've read my statements over the last year, you have a very clear idea about my thinking, particularly my high premium on balance and the balance in decision making. We were all faced with lots of dilemmas last year. My colleagues and I had lots of dilemmas, innumerable dilemmas, unimaginable dilemmas. We had to make decisions that affected millions. And we used, the decisions that we made, the choices that we had before us were very difficult. The choices we had were between a bad decision, a worse decision, and a far worse decision. What we tried to use to the best of our ability is cost-benefit analysis to make these decisions. And sometimes it was not terribly clear, the cost and benefits. It was hard to ascertain those. But there is one cost-benefit analysis that is crystal clear. The cost to our kids by keeping them out of school and remote learning is immense and far outweighs any benefit. The cost to our kids includes costs to their social development, their emotional well-being, their long-term mental health, and these impacts are going to last for a long, long time for many of them. The data is very clear. We're seeing significant rise and increase in all sorts of issues: anxiety, depression, self-harm, suicidality, alcohol and drug use, and a host of other chronic mental health conditions. The data is clear. Kids must return to school. School must begin full-time, in-person, full classrooms this fall, if not sooner. The data is also clear. This can be done safely, which you'll hear about shortly. There is no other viable option. School must completely go back to normal in the fall. I'm now going to turn it over to Dr. Sara Cody, who's the health officer for Santa Clara County.
Thank you, Dr. Morrow, and good morning, everyone. My name is Dr. Sara Cody. I'm the health officer for Santa Clara County. And we are here today to urge every school at every level to open their classrooms for full in-person learning for all students. And on this, us Bay Area health officers stand together. This is our first in-person reunion since our shelter-in-place order in March 16th. As you know, we have charted slightly different paths over the course of the pandemic. It's been enormously difficult. On this, we are 100% united. I want to express my gratitude not just to my fellow health officers, but to the education community, all of the county superintendents, the superintendents of each school district, the teachers, the staff, the students, and the families. We have all worked very hard over the last year to ensure the safety of all. The safety of our education community has been our top concern during this pandemic, and we have learned a lot as we have progressed through the pandemic. We've adjusted our guidance as necessary when we've learned more about the science of COVID, how it spread, and how it impacts schools and our communities, and we have pivoted as necessary. And this is why at this moment in time, we feel that it is urgent for schools to be open to all. So I just want to close after the Muni passes. Again, with my gratitude to the entire school community and to all of the leaders in every school who have worked in partnership with all of us over this pandemic. And of course, to my fellow health officers. And I'll now turn it over to Dr. Matt Willis, the health officer for Marin County.
Thank you, Dr. Cody. I'm Matt Willis, Public Health Officer for Marin. Good morning. I want to start by thanking Dr. Cody and my fellow health officers for the collaboration and the leadership that you've shown over the past year plus. As Dr. Morrow indicated, a lot of the decisions we made were not clear-cut, and one that is clear to all of us, especially now where we sit with a year under our belts of experiencing schools, is that we can and must reopen schools fully to in-person learning. And while this is a national priority, we in the Bay Area are in an especially good position to see all students back in classrooms safely. First, we've seen firsthand that the rate of transmission within schools is low. In Marin, for example, with now nearly 3 million accumulated student days across 110 open schools, we've seen no occasions where a student infected an adult in school, and found that children are far more likely to be infected outside of school, in the general community, than within the school. Second, the Bay Area has high vaccination rates. In an analysis published in mid-May, 7 of the 15 most highly vaccinated counties in the United States are Bay Area counties. The state and region also has correspondingly low and declining COVID-19 case rates. These factors, taken together, low baseline risk of in-school infection, the new protection of highly effective vaccines on a backdrop of low community transmission, combine to support our unequivocal support and public health recommendation for full reopening. I'd like to introduce Dr. Gail Newel, Public Health Officer for Santa Cruz County.
Good morning. It's such an honor to be here with my colleagues, fellow health officers from throughout the Bay Area. As the others have noted, returning to school in person, in the classroom, full-time in the fall is imperative. Public health researchers, the Centers for Disease Control and Prevention, the California Department of Public Health, and local health departments have learned from the research and the experiences of classroom instruction from the fall of 2020 through the winter and spring of 2021. The science is now clear that the risk of transmission among children wearing masks is very low, even with reduced spacing between desks. You'll find in your press release a link, a hyperlink that you can refer to for a CDC science brief on transmission of COVID in K-12 schools. There are 72 scientific articles, research, in which to base our recommendations today. The conclusions of that scientific brief stress that reducing transmission in schools is a shared responsibility. I'd like to thank our educators and our education community for everything they've done to work alongside us for this shared responsibility, as well as students and parents and the families of our communities. It's clear that a combination of effective prevention strategies will be the answer to safe reopening of our schools, our classrooms full-time. The use of masks, physical distancing, hand washing and respiratory etiquette, cleaning and maintaining health facilities, contact tracing along with isolation and quarantine will limit transmission in the school settings. And vaccinations are key. They are so important and will keep our teachers and our older students safe as they return to the classroom. At this point, I'd like to introduce Dr. Chris Farnitano, Health Officer from Contra Costa County.
Thank you, Dr. Newell. I would also like to thank all my fellow health officers across the Bay Area for all their tireless work over the past year to help keep our community safe. This pandemic has disrupted much in our lives and in our children's lives, much more than just our children's education. Because schools are not just places for academic learning, they are important for children's social development as well. School is where kids go to meet new friends. It is where they go to play with other kids. School is where they go to learn about life and develop social skills. These skills are learned in class and out of class, in the lunchroom and in band, in sports teams, and in after-school clubs. Schools are also an important part of the social safety net for our young families. For many children, schools provide them with the most reliable source of healthy food through the school lunch and school breakfast programs. While those programs continued during our year of remote learning, it was harder for students to access the meals if they were not already on campus for class. For students who live in troubled homes, going to school offers kids structure and refuge from what may be a chaotic home life. A teacher, coach, or classmate may be the first person to notice a child or teen struggling with mental health issues and help connect them to a school counselor. In addition to not seeing the inside of a classroom for much of the past year, our kids have also missed out on many cherished rituals and milestones during the past year plus of the pandemic. Unfortunately, most students in the Bay Area have been unable to experience traditional graduation celebrations with their friends during the pandemic. Events like homecoming, senior prom, school dances, and grad night have been missed or greatly scaled back. These are important events and memories that last a lifetime. These shared rites and passages and milestones are vital to the mental health and well-being of our children as they grow up. School is much more than a classroom. I want to turn back to Dr. Phillip.
Thank you, Dr. Farnitano. So from our statements today, from our press statement, from our presence here together, I think you can all see how immense a priority this is for all of us who are responsible for the health of all residents in the Bay Area. It's time to move past the remote learning model and back to the full range of learning and support that our educational communities provide. Bay Area health officers urge school administrators, teachers, and parents to work together now to plan for full classrooms for all grades in the fall. And with that, we will open for question and answers. If there are particular health officers that you would like to respond, please include that at the beginning of your question. Yes, thank you.
Great, thank you. Stephanie Sierra with ABC7. This question is for every health officer. First, I want to thank you all for being here today. I want to start with Dr. Cody, if I can, but the question applies to everyone. Once school resumes, will students and teachers be required to wear masks inside the classroom? If not, what situations will masks be required?
In Santa Clara County, and I believe in in all of the Bay Area health jurisdictions, we will be following the guidance, the school guidance from the California Department of Public Health. I would invite any of my colleagues if they have any refinements on that. But I think that we are, through the pandemic, we have been working with our partners at the state and adapting. They've been adapting according to CDC guidance, and that's the guidance that we will be following. Thanks.
Okay, thank you.
Anybody else want to?
Hi, Kathy Novak from KCBS Radio. Again, for everyone, but perhaps I might start with Dr. Phillip. Here in San Francisco, one of the barriers to widening the reopening seemed to be staffing, and the fact that hundreds of staff were applying for exemptions if they were at high risk or lived with someone at high risk. I wonder if you have a message to the staff who are still concerned about going back to work.
Well, I think our message is for everyone, for families, for staff, for anyone who is concerned about COVID-19. As Dr. Willis has said, the vaccines have been the key, the change agent in allowing us to talk differently, to think differently, to have different and more open policies here in San Francisco, the Bay Area, and nationwide. And so what I would say is that people should get their COVID-19 vaccine if they have not. Increasing amounts of data over time and over many millions of people who've gotten these vaccines show how extraordinarily effective they are at preventing infections and preventing severe disease and death. So taking advantage of the opportunities to get vaccine is the number one thing that teachers and families can do to protect themselves and, quite frankly, to protect students. Our data show that students who have become infected have done so because there have been unvaccinated adults within their household, not from being at school.
I'm Solomon Moore with Bay Area News Group and Mercury News. I wanted to know from any of you if there's any serious active proposal to extend distance learning proposal in Sacramento. Also, if schools do reopen and there are outbreaks and distance learning authority has been ended, what kind of plans do you have to deal with such a situation? I'll call on you if you make me.
I'll take it. We work really closely with state officials, and what we are hearing from state officials is they are very committed to full in-person learning as well. So we are working closely with them, and we see the state health officials are also working very hard to get all of our students back to school in the fall. We have plans, and we have exercised those plans to deal with outbreaks in schools, and we'll continue to have those plans. We do expect there will be cases at schools, especially until we have a vaccine that's available for younger students. But we know from experience that even when there are cases at schools, transmission in the classroom is very, very rare. So we have plans to identify cases, do contact tracing as we've always done, and try to minimize the risk in classrooms. But we know that classrooms, even when we've reduced the spacing between desks to 6 feet, then 4 feet, then 3 feet and less, that the classroom environment is a very safe environment, and it's getting more and more safe as more of our older students and staff are vaccinated.
I just wanted to follow up, though, on the first question, which wasn't about support for reopening of schools, but rather, is there support to extend distance learning authority?
Some schools may have been developing options for distance learning. We still want to have the option for in-person learning available for every family who wants to bring their children back full time.
Hi, Jill Tucker from the San Francisco Chronicle. I'm wondering if somebody, maybe Matt or somebody, could address more specifically what you would like to see the school day, the school week, the school year look like. Do you envision dances and football games and crowded gymnasiums and band practice and PE? In the gym. I'm wondering if you could just sort of specify what that would look like and what would be acceptable. And then also specifically, if you believe any social distancing will still be required, any quarantining, and under what scenarios that might be, or ventilation recommendations. What types of recommendations do you still envision having in the fall when we are fully reopened as a state?
Thank you for that question. Our goal, as we've said, is full reopening, full time, to classroom-based learning. There will be, especially it will be different for middle and high schools where our 12-year-olds and above now can be vaccinated, and all the staff in those settings can also be vaccinated. So the mental image is a really well-protected environment where both the students and the staff have that benefit of a 95% effective vaccine. The other additional benefit that Dr. Farnitano mentioned is that in those settings, when transmission might occur, the consequences of infection are much less, right? So you're much less likely to come to the hospital, much less likely to have severe illness or pass. And that's an important piece of context to protect both those that, who may be not able to be vaccinated or those who are more medically vulnerable even after they've been vaccinated. For younger elementary school settings, until we're able to, we're eager, obviously, for the emergency use authorization for children all the way up to age 11. I think we're looking at likely starting the school year before that happens. So we're looking at environments where facial covering, as much as reasonable social distancing as practicable within that setting, will be important for elementary students. But again, because the adults in that environment have the benefit of vaccination, the consequences and the risks are much lower. And then from there, it really is, I think it's similar to the way we're approaching the post-June 15th world, which is understanding ourselves the principles of safety and applying them situationally in a variety of different settings, rather than have a specific set of regulations that deals with every possible contingency. It's really up to leadership at the school level with the guidance of public health to determine what the risk is in that particular setting, understanding the way transmission occurs. The question is, will it be recommended if there's a 2-week quarantine? If someone tests, it depends on the nature of the exposure.
Any other follow-up question?
Just another question about how you are verifying vaccinations, and what if there's families who choose not to vaccinate their children? How do you approach that situation? Will they be able to still come to class, or how will that be addressed? And Matt, Dr. Cody?
To my knowledge, and I invite any of my colleagues to speak if they understand differently, there's certainly no statewide system regarding vaccination of students. Schools, such as many universities, have put into place policies where they do require vaccination and check vaccination status. And of course, Cal OSHA regulates the work environment, so employees and staff at a school, that the school would need to know their vaccination status, but there's nothing across the board regarding students. I do want to just emphasize what my colleagues have said, which is how safe and effective the vaccines are, and how they have completely changed our ability to do so many things and how important they are. And given that they can now, anyone age 12 and up can become vaccinated and protected, that really opens the doors wide open for so many things, including in-person school. Thanks. So
just to clarify, though, so you're saying it's up to the individual school district to make that determination about verifying vaccinations? So
the Cal OSHA governs and regulates the employer setting. So a school district, they are employers, and so that governs the staff of that district. It doesn't, however, govern the students and the families. So there isn't anything, there's no system in place that requires that a school know the vaccination status of the students. However, if there's, for example, an outbreak or a concern about transmission in a school, then the outbreak investigation, of course, we would need to know who was not protected from the vaccine and exposed, because those would be people that would need to quarantine for the regular quarantine period. Thanks.
Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.